Welcome to the Equine Vet Connect Podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect Podcast here at Countryside Equine Hospital. It's a big day in podcast land today.
Why is it a big day, Dan?
I think because we have reached 100 episodes.
Woo!
We've recorded 100 episodes. We have educated the horse owning public, for better or worse, who knows?
100 times.
100 times.
Like we said this in episode 50, but I'm just shocked people have listened to us 100 times.
Yeah.
I know.
If you're an OG and you've been here since day one, thank you.
We really appreciate it.
If you just got here on episode 99, thank you.
Yes. I was kind of, when I was driving in this morning getting ready for this, like I'm going to show my age here, but I remember when The Simpsons had their 100th episode. And that's what I was thinking about. I was like, we just reached episode 100. Homer did a backflip.
I'm not.
Are you going to do a backflip?
I thought about it. No backflips this morning, although our YouTube views would probably go up if I did a backflip.
Potentially.
Yeah. If we had trampoline,
I might could pull one off on trampoline.
Like on trampoline.
I could not.
I don't know if my back actually bends backwards. It'd be more of a layout.
Mine does not.
We'll have an ambulance on standby and like a neck brace and everything.
I wonder if I get workers' comp if I did a backflip.
I mean, you're the boss, Dan. It's really up to you.
You just have to explain to the insurance broker, listen, it was our 100th episode of our podcast.
Yeah.
I had to, and they're like, oh, of course.
Yeah, of course. Case for the case
absolutely.
for the plaintiff there. He's got to have it. 100 episodes. Homer did a backflip. Yeah, Dan had to do it.
You had to.
We definitely should have had cupcakes or confetti or something.
Yeah. Well, you can edit something in. Yeah. Do something.
Really the 101st episode's the biggest, right? Because then we're in the hundreds. We can then definitely say we've done over 100 of these. That sounds cooler. So today, all right, you're probably not going to be educated. We're going to call this Spills and Thrills.
Thrills and spills.
Thrills and spills. So this is going to be cases that help define us, people that help define us, how we got here.
For better or worse.
So that's kind of what we're talking about today. So
it's just going to be a walk down memory lane.
I think it'll be good.
Pulling up all my repressed memories and things.
Just going to dig out a lot of trauma, make a little trauma salad.
Ooh, trauma salad would have been a good title for this too. So
my name's Caitlin, and I brought.
See, I feel like I had a lot of great things. I remember a lot of the good stuff.
Maybe that's the difference between us.
Yeah, because the good things are great, but the bad things really stick with you, man.
You don't lay awake at night and remember every bad thing you've ever done in your life, and it's just all flashing at the same time.
We do.
I woke up in the middle of the night last night and thought about something dumb that I did when I was 16, and I was like, man, that was so embarrassing. I can't believe I did that.
That's a good thing about getting older. You start to get the memory loss from the things you did. Now, there's some things I wake up, this morning, woke up, I was limping a little bit, kind of having trouble getting upright, and I started thinking about all the things that probably led to this slow
decline
walk to the coffee maker. So, yeah.
Well,
so I was thinking, I guess one of the things that, I'd love to do is people that have helped change your career. Because the one thing I tell everybody, no one gets here alone.
No.
Nobody gets here alone. So I'd love to start with some people that help shape us and help change our careers, how we look at things, mentors, things like that really kind of changed how we practice, or, a lesson we took away that we carry with us every day. So I don't know if y'all want to start with that or.
Yeah. I think mine is one of the first equine vets I ever rode along with. Is the one that actually turned me on to the University of Florida's program. So, it had never even really been on my radar. I mean, I was a Midwest girl. I'd lived in the Midwest my whole life. And, at that point, never really had even considered moving anywhere else. And I started riding around with, it was actually a friend of mine from college. Her dad was an equine vet, and she's like, hey, like, do you want to come like hang out with my dad for a couple of weeks and, ride around? And at that time he was practicing in kind of like central, like north part of Wisconsin. And so I was like, yeah, sure. So rode around with him and had a great time. It was my first time ever really riding in a truck. And he was one of the first classes that ever went through the University of Florida in the 80s. And was
Oh,
like,
wow.
hey, this is a pretty good program, and like you should check it out. And I think that's truly like what got me into it, and went down there, checked it out, absolutely loved it, and here I am. And I don't know if I would have ended up where I am today had I not decided to go ride around with this guy. So
Yeah.
thank you, Dr. Palmer.
I'd say, I have several, but I think kind of going off of that very early on, I was also from the Midwest. I went to Ohio State for undergrad, had planned to go there for vet school. Like that was the plan since I was little. That was the plan. And I interviewed there and I didn't really love it. It just wasn't a good fit. And I was like, oh, okay, what am I going to do? Like, obviously if I get in, I'll go, but like, eh. And then I came down to Auburn and I interviewed, and I had one of our clinical pathologists, Dr. Pete Christofferson. He was in my interview panel, and we hit it off. Like I was like, these are the programs that I'm looking at. Like, why should I pick Auburn over these programs? And he was honest with me. He's like, only if you want to. Like, this is what we have to offer. We think it's great, but like, if it's not the right fit, that's totally fine. But like, we want you to be here. And he literally like followed me out of my interview, found my family, and was like, she needs to be here. Like, she needs to come here. And it was just, this guy had never met me before. Like we hit it off, and, he liked what I had to say, and he believed in me from the get-go, and, changed my whole entire trajectory. Like from that interview, I was like, if I get into Auburn, that's where I'm going, and like totally changed my, my path in my life, and changed a lot of decisions that I made, and definitely would not have ended up here for sure had I not, met him. And so yeah, he's a character though. He's funny, but definitely a very strong first interaction with that school. So
That's pretty cool.
Yeah, that is cool.
A lot of people can't tell the story like that,
Yeah, it was special. I felt very appreciative, and he just knew, and I was like, all right.
Yeah, I was thinking back, and I'm definitely not going to tell the story about how I decided to go to vet school or anything, because that probably doesn't need to be told. So, but one of the things I think about is I did know when I got there, I wanted to do lameness. I love lameness. I loved orthopedics. I loved horses limping, and making them not limp anymore. And I had no idea how you did that, which is what we learn at vet school. And I always forget. I'll never forget this person. Randy Eggleston was at the University of Georgia, and one of the things that he was just so adamant about. He said, when a horse walks in and it's lame, you block the horse. Block the horse. You do nerve blocks. You do joint blocks. You isolate the lameness. He's like, we don't guess. He said, I don't care what you think. I want to know where it blocked. And so, armed with my trusty bottle of Carbocaine, and the other thing is, what was interesting is I also had the opportunity to work with some people that were the best in the world at this. And I noticed, like, Randy Eggleston, block the horse. I went over and worked with Jamie Carter and Aiken on an externship, block the horse. I get up to Kentucky, there's Larry Bramlage standing there. Like, he's one of the premier orthopedic surgeons in the world. Block the horse. And so, you know what? When I got out on my own, guess what I did? I blocked the horse. I told somebody one time, like, if I could ever get a sponsor for my career, it would be Carbocaine. Like, this career brought to you by Carbocaine, because all the lamenesses that have walked in here over the years, and all the ones that I was a second and third opinion on, or even just a primary, nobody could figure out what was going on. And everybody been chasing things all around, and you look through the record, nobody blocked the horse. And so I just reach over, grab a bottle of Carbocaine, I start blocking the horse. Lo and behold, here's where the horse is lame at. We image it, we find the problem, we get it sorted out. And I've been fortunate enough to build a 17-year career off what Randy Eggleston taught me in vet school, which was block the horse.
Mm-hmm.
And
Back to the basics.
it's simple.
Mm-hmm.
Yeah.
It's simple. It's basic. Everybody tries to figure out how to get around it, but it goes back to fundamentals.
Yeah,
Mhm.
that's something, Jamie Carter drilled into me too, is like, keep it simple, stupid. Like,
Yes.
just keep it simple. Like,
Yep.
go back to the basics. Don't make it complicated. Just like do your thing. And he's another one for me, and, everybody at Southern Equine, where I did my internship. That was the first equine only practice I'd ever visited as an extern. And, the first year of vet school, everybody was like, don't do equine, don't do equine, don't do equine. Like, you can't make money, you can't make a living, you have no
Mhm.
work-life balance, blah, 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 blah. And, I rolled up there and they were basically like, no, you absolutely can do it.
Yeah.
And like really opened my eyes and, let me do a lot of things right out the jump as an early student in vet school. And I was like, holy cow, man, like this is awesome. Had a lot of really cool experiences at that practice, learned a lot from all of those doctors, and, really owe a lot. I owe this job to Jamie Carter. He hooked me up with Dan and was like, go on. So
Mm-hmm.
yeah, Southern was, there's a lot of really strong mentorship that came out of that program.
Yeah, I totally agree, because I think that was one of, not the first, but it was one of the first ones that I did as an extern as well. And like, that was, I think, the first time that I was like, I can actually see myself in this job.
Mhm.
Like,
Yeah.
where I'm like, I could be one of these associates,
Mhm.
Mhm.
doing what they're doing.
Yeah.
Like, and it's like when you finally have that like aha moment.
Mm-hmm.
I've always said Jamie's the only man I would ever gone to work for.
Mm-hmm.
Yeah.
Like everybody I've ever met, and all, Jamie's the only man I'd ever gone to work for. I didn't, because, but I think about that. We're talking about keeping it simple. Really, when I think back, like when I started shoeing, I worked with some of the best in the world. I had, I trained under Bill Sanders, Justin Frank as a farrier, both those guys. I went to clinics with Jim Poor, Jim Quick. Like these are like the legends of the farrier world.
Mm-hmm.
And what I noticed is all of them did the same thing every time. It's like, keep it simple. You put the basics in every job you do. Just put the basics into it, and you keep it simple. And then what I noticed, I meet Randy. He's one of my professors in vet school. What do? We kept it simple, put the basics in everything.
Mm-hmm.
I get up to Rood and Riddle, which is like the Mayo Clinic of the horse world. And then if I'm working with Brian Walters in internal medicine, who's another great friend of mine, huge mentor, internal medicine guy, he put the basics in everything he did. He kept it simple. You get around Larry Brown, which foremost orthopedic surgeon. What do? We keep it simple, put the basics in everything that we do. I'm working with Raul Bras, a phenomenal podiatrist. And what was his favorite saying? Keep it simple, homie. That was his favorite thing to say. Man, don't overdo it. Keep it simple, homie. And I started to notice a trend there. And it's funny, we've all said the same thing. It's like, no matter what hits you, it's keeping it simple, working the steps, sticking with the basics.
Mm-hmm.
And it's interesting to hear both of y'all say the same thing. Like the guys y'all brought up and the people you brought up, they're like, keep it simple.
Mm-hmm.
Even, Dr. Erin Groover at Auburn, who is like she's like an idol for me. She's an
Mhm.
internal medicine specialist. She's phenomenal. Like the first time she gave me a lecture, I was like, oh my gosh. I was like, she's like the epitome, like she's it. And, but she says the same thing. I'll call her with like a complicated case that I'm like, I don't know what else to do. And she's like, start at the beginning. Give me the signalment, give me the history,
Yep.
give me the basics. Like, let's work through this from the beginning. And I'm like, man.
Yep.
Mm-hmm.
Same at UF, Michael Scher. He's been there since like day one as well. And he's taught everybody that's come through UF. And his thing was always look at your patient.
Mm-hmm.
Like, stop looking at the labs, stop looking at the imaging.
Yeah.
Like, you're getting so blindsided. You need to just put all that away and look at what your patient's telling you.
Mm-hmm.
Mm-hmm.
And it's like, when that, I think, has been one of those things that like sometimes I'm like in the middle of something and I'm like, oh my God, I've got all this information. Like I have so many ideas and I'm like, nope, think about what Uncle Mikey told me and just look at my patient.
Well, we had that last night. We've got an intern here now, Reagan White. She's our intern.
Mm-hmm.
Kate, you took the case in. I was the doctor on call last night, so I was looking at it, and Reagan was there. And we got this horse on, we had to put the horse on fluids because of a colic, and the PCV just starts dropping
Plummeted.
like faster than they normally do.
Yeah.
And so, of course, we're all like sitting there scratching our head. And I remember I was talking with Reagan about it, and I was like, as I'm looking at the horse, I said, we'll run a quick scan of his abdomen, make sure we're not bleeding anywhere. And did that. And I was like, our patient is perfectly normal.
Stable.
Heart rate's great. This patient's happy. Gut sounds are improving.
Right.
Everything's great. We've got one number, or I guess two numbers that seem off. They got lower than we thought. But it's like, we got a really stable patient sitting in front of us. You know what we're going to do? We're going to treat this patient. We're not treating that. We're not treating the blood work.
Yep.
We're going to treat a patient.
Yeah.
And sure enough, we come in this morning.
He's fine.
PCV's perfectly. It's just bounced right back up into 36 where it's supposed to be. And
there's lots of things that happen in that body that we don't know about, that we don't need to know about. And that's just a snapshot in time. And if you get it at the wrong moment, you're going to be like, and if you go on a wild goose chase from that one number, you're going to get confused.
Yeah.
Well, I can remember too, like when I was at Rude, I leave the university, and, when you're monitoring anesthesia, you've got, Lord knows, you've got every possible monitoring.
Oh, yeah.
Like, the CO2, how much ISO's in, ISO's out, it's calculating MAC for you. I mean, this thing is, like, if it could turn the knob, you wouldn't even need an anesthesiologist, like, running the numbers.
It's running.
And I remember I got to Rude, and we had great monitoring equipment, but there was a lot of things we didn't have. And I remember asking the anesthesiologist, I was like, we're not monitoring end-tidal CO2. We're not monitoring the isoflurane. We're not monitoring all this. And she's like, we used to, but then we had interns that anesthetized the machine and not the patient. Mm-hmm. So we found that our patients did better when our interns didn't have all the toys.
Yep.
And I thought back to what my mom said when she used to be a nurse manager in the operating room. Mom, you made the podcast. But she said when they got doctors fresh out of residencies, they needed every piece of equipment in the world. And then all of a sudden they'd go down to a third world country with a Doctors Without Borders situation to go help out somewhere. And, they're down there running anesthesia, and they got like their fingers in the stethoscope. And they come back, and their first question is, what's all this stuff doing in the OR? Mm-hmm. She's like, well, that's all the stuff you normally want. Oh, get rid of that. And she's like, that's when you made an anesthesiologist. Mm-hmm. When they quit anesthetizing machines and anesthetize patients.
They drilled into us in anesthesia, your best monitoring equipment is you.
Yes.
That's your best monitoring equipment, is you and your brain and your all your senses, and that's your best monitoring tool, because the machines will lie to you.
Oh, all day. Mm-hmm. All day.
Yeah. Yeah. Yeah, I think, oh gosh, there's so many things that we could talk about as far as, people and mentors and cases, but when I kind of look at all the cases, and it's all that same train of thought, it's like, treat the patient, not the numbers, keep it simple, go back to basics. The cases that stand out to me the most are the cases where I got so muddled and so confused, and then it's like I ask somebody for help, and it's like, start over. Mm-hmm. Start from the bottom, and then you figure it out.
Or did you do this? And you're like,
no,
I didn't think to do that. And it's like running a CBC cam.
Yeah.
Don't skip steps.
Yeah.
Don't skip steps.
Yeah. Yeah.
I think one of the other ones that I often think about was, and this is not a veterinarian, it's actually a human orthopedist, Dr. Joe Christian. I actually got to talk to him a few years ago. He did surgery on me when I was a kid, 11.
Wow. This is crazy.
Yeah, and I remember this guy was a 20-year veteran of orthopedic surgery, and I needed to have pins put in the hip to hold the top of my femur on. And, of course, he looks at my mom and said, get it scheduled for next week. He said, I can do the surgery. Not a problem. But I need to call this guy who's up at, I can't remember if he was at either MCG or up in Ohio. I can't remember. But this guy did these all the time. He did them he did a lot of them. He's like, I can do it. I'm not worried about it, but let me call him because he does more of these. I just need to get the details. We can do the procedure. He said, I'm not worried about that. He goes, I want to know the ins and outs. Mom was like, okay. So lo and behold, he does this procedure, talks about it's all about, the guy Danny told him it was all about alignment. I don't know what his last name was. I just remember Danny. I don't even know how I remember this, but it was all about alignment. So my mom sat there and told me, said he sat there forever getting everything aligned. And once he finally had everything aligned, he made the tiniest little stab incision, thump, over and done. It was like 20 minutes in alignment, 3 minutes of surgery. But both surgeries went absolutely perfect because he made a phone call. And I can tell you where you started, where the incision was to put this in is not where you think it would be.
Yeah.
And that was the one thing Danny told me. He said, you've got to get the alignment right. And, of course, it took forever because this is back before digital x-rays. So, I mean, you had to literally shoot plain film, run next door, develop it, come back to the OR, hold it up. I mean,
we're so spoiled.
I know that's how it was.
Really are.
But I often think about that. You know, here's a man with 20 years of orthopedic surgery experience, has a phenomenal reputation, but he wasn't too arrogant to know that, you know what, this guy knows more than I do. Let me call him and get the ins and outs. And I brought that into my career because a lot of times I'll tell people, like, I can do the surgery. I'm not worried about that. But I need to call and check with this person because there may be some little detail, or I can do this procedure. Or, this is what it is. But you know what? I know the person that's the expert in the world in this. So let me call them and give me a few minutes.
I just had that recently on a case that, you know, I was a second opinion on a tooth root abscess on a lower premolar on a young horse. And I worked on it for 2 days and I could not get it out of there. So I called Dan and Dan came to help me and we worked on it and we did everything that we knew how to do and we still couldn't get it. So we're both on the phone calling people that we know more than we do. And, you know, we both got to the same answer. And, you know, thankfully, Dr. Mike Sissel out of Aiken, he drove over and helped me the next week. And sure enough, 20 hours later, we got that sucker out of there. But, you know, it took him a long time too. And but the thing that struck me the most, and I've always known this about him, I've worked with him a lot, and you know, he's very good at what he does and he's very experienced, but he's very humble too. He got here and he was like, well, shoot, like this is not going as easy as I had hoped it would. He's like, maybe I'm not doing something perfectly. Maybe I'm not, you know, like he's so humble and he's like, I'm just going to do the best that I can. He's like, I'm going to do what I know how to do and we'll change course if we have to. But he's like, you know, sometimes I'm not the best at these either. And I'm like, dang, well, if you're having a hard time and you know.
That's all he does.
Yeah, that's all he does all day. I'm like, well, it makes me feel better. But I'm like, but he's literally an expert at it. And he's sitting here eating a big old slice of humble pie. And, you know, it's cool to me to, you know, you look up to all these people and you look up to your mentors and they've been through all the same things that we have. You know?
They have their own mentors that they're looking towards too. And they probably have somebody that they're going to call as well.
And he did. He's like, I'll call people too. He's like, I have so-and-so on speed dial and I'll call them and be like, you got any other ideas?
I mean, one of my favorite sayings is Tiger Woods has a golf coach. I mean, there's no doubt. He can play golf.
Yeah.
But when he goes out there, he's got a caddy that knows just a little bit, I would say. And he's also got a golf coach.
Yeah.
So I think you're never too good.
No.
And you never know everything.
I think the people that do feel like they know everything or that don't struggle with the, you know, the imposter syndrome and the questioning and all the things, I'm like, those people scare me a little bit.
Yeah.
But
Arrogance.
I'm like, arrogance scares me a little bit. But if you come in here and you're humble and you ask questions and you want to learn and you're still reaching out to your mentors, I'm like, that's a person who wants to learn. That's a person who wants to work hard. And, you know, I really appreciate those people. And I appreciate those people who have been like Dan, who've been doing this for years. And they're still like, we'll figure it out.
Yeah, let me make a phone call.
Yeah.
When I think about that too, you know, my dad was a pilot, and you don't realize all the things that kind of change your life as you're moving through, right? So my dad was a pilot. When my mom first met him, she said he was just the most arrogant person because she asked him if he was good, and he said he was the best. And she got frustrated because she couldn't find anybody to say any different. But one of the things my dad was big on is that arrogance gets you killed.
Yes.
You know, we had a saying, there's old pilots and bold pilots, but there's no old bold pilots. Arrogance gets you killed. Never to be too arrogant to ask somebody.
Yeah.
And that's one thing that, you know, I've kind of carried with me throughout my career, you know, for a long time, is arrogance kills.
Yeah.
Arrogance kills. Know your limitations. Don't be afraid to throw your hand up, ask for help. Don't be afraid to make those phone calls. And then if you're not the one, don't be afraid to send it to somebody that is. I think that's like we have a saying around here, we don't do egos.
Yeah.
No.
Rule number 1 in our practice, you got an ego, this is not your place.
You're going to have to
If you're here for like glory and to make yourself look great, this ain't it. Because that's what gets us in trouble. We're here to take care of a horse. We're here to take care of a horse. And by whatever means necessary.
Yeah.
And a lot of times that's swallowing pride. Because Lord knows I've had to do it.
Yeah, I think early on that was a big thing for me is, definitely learning how to say, I don't know with confidence. Like, I don't know what to do, but I will figure it out, or I will call somebody who will figure it out. Like, we will get there, but being able to say, I don't know, but still instilling confidence in owners and clients. And,
right.
It's a tricky, skill to learn, but it's like once you do it, it takes such a load off because you're like, gosh, I don't have to be perfect. I don't.
Right. Well, because we can't be. You cannot be perfect. It's like, we have this very high expectation for ourselves. And I think a lot of clients do too. You don't want your provider to make mistakes, but sometimes we pick the wrong medication. We go down the wrong, diagnostic path. We don't act in time and we miss something. It's like, it happens and it's bound to happen. It doesn't matter how good you are.
Yeah.
You're going to mess up at some point. And
that's the spills part of the thrills and spills.
Right. And this is where we turn, this is where we get dark. But it's like, I think when I was a very young vet, I think I was terrified to mess up. And I think that prevented me from doing a lot of things because I was so scared that I was like, well, what if this messes up? And, like, you do have to mess some stuff up sometimes, unfortunately. And that's, and again, that's a really not a great situation because it's like, yes, that a lot of times that is somebody's animal and, you don't want to mess it up. But, I think once you can accept that, like, yes, it's going to happen. Yeah. It does.
They call it practice for a reason.
Yeah. One of the things that came to mind for me was, I was thinking about during my, one of my first rotations, it was shelter med. And so we're, spay and neuter lab and taking off masses and stuff. And, I have this shelter dog that comes in, so didn't have an owner, but, I'm doing my spay and I nick the spleen. And that sucker is bleeding and bleeding and bleeding. And I am panicking. And the resident comes in and he's so calm. And he's like, all right, we're going to figure this out. And, we clean it up. Dog waked up a little pale, but she woke up. She was fine. And he came to me and he said, you're doing a spay tomorrow. And I was like, I don't want to. And he's like, nope, you're doing it. Yeah, you have to.
You have to.
He's like, you have to get back up on that horse. And you know what? Did it the next time. I didn't nick the spleen ever again. I haven't done a spay since then, but
you've done 2 more than I have.
But it's one of those things of like, what you're learning. You have to give yourself that grace, and you have to say, okay, I did this. I don't like that I did this, but we're gonna get better from it.
What's the next step? Yeah.
How do I be better?
Yeah.
I had that just on a mask the other day. I was taking this mask off and, you're in there cutting and life is good and you're literally almost done. And next thing you know, you've hit this massive blood vessel.
You're like, dang it.
And you're like, dadgummit. But I can tell you the difference. First year in practice, I'd have been like, oh crap, what are we going to do? This time I'm just like, oh man, am I going to get blood on me? Like, because again, I've done this enough that when that happens, it's like, okay, we should probably stop that from bleeding.
Yeah.
And then you just go in, you go back to basics. There's a vessel with a leak in it. We need to go find the vessel and stop the leak.
Yeah.
And so you just go find the vessel, you stop the leak.
Yeah.
But when that happens the first time to you, because I think we've all been there on that first mass we're doing, that first surgery we're doing, and just like the spleen, you're like, oh crap.
What do I do?
Oh my God.
Yeah, you start freaking out a little bit and then you're like, oh.
Pressure.
Yeah. All bleeding stops eventually.
All bleeding stops eventually.
So.
Yeah. I think it's hard to learn to set expectations for clients and also for yourself. Like I hold myself to a very high standard, and it's like sometimes you're just not going to meet that.
No.
Sometimes you do everything you can and it still doesn't turn out the way you think it will or the way you hope it will. And that's okay.
Well, and one of the things that, and I just started saying this in the past year, when I'm working on some of these lameness cases, and they're not the easiest things in the world, I tell you what, we're going to do everything we can. We are going to do our part.
Yeah.
The horse still has to do theirs.
Yeah.
Sure enough.
And I think that's what, one of my favorite sayings, if it works every time, that's physics.
Yeah.
The 80-20 rule is biology. Like if this works 80% of the time, that's biology.
Mm-hmm.
If it works every time, that's physics. And that's the thing is, we're still dealing with animals, and there's a lot that changes, I think, between your first year in practice and even you're coming up on 6 years. You're coming up on 5.
I just hit my 5.
Yeah.
So.
Just hit your 5th, so you're in your 6th year. Counting your internship.
Mm-hmm.
And it's like I tell everybody, it's like things start to change.
Yeah.
Like 6 and 7, like 5 and 6 can be a little rough, and then I think when you get to 7, it's like, oh, been here, done that.
I think on that note too, you see things that you're like, there's no way this is gonna work. Like, there's no way. And like I had one that it was, puncture wound straight into the tendon sheath. Like, there's just mud and grass coming out of this tendon sheath, and the owner was, I don't think as aware of how severe this situation was, and was like, okay, so I gave this thing like a couple antibiotic shots and a tetanus shot and a prayer and said, okay, let's go. I saw this thing a year and a half later. The horse is sound.
Oh my God.
Completely sound. And I'm like, you are joking.
Then you got the one that does everything right. It
Yeah.
hits the door. We do surgery on it.
You flush it.
You flush it multiple times. You do everything perfect.
And it goes scrap.
And it goes crap.
Yep. And I'm like, I'm thinking about that one that was just chilling out in a field.
And there's no rhyme or reason to it.
No, there's no reason that thing should have
Oh, Lord.
done that. And I'm like, are you joking? Are you joking? Like, man, that gent shot was working so hard that day, man.
Out there doing the Lord's
Gent
work.
shot was like,
I had a fetlock laceration come in on a 28-year-old horse, and we get to surgery. And I'll never forget, we get him in there, we drop him, get the bandage off. And I start exploring the wound and good old purple spray, which if I could ever get a constitutional amendment to ban that, I would.
Go back to episode 50 to see me crash out about purple wound spray. I will.
But there was purple wound spray on the articular cartilage of this joint.
oh.
Okay.
That ain't never coming off.
And I'm like, well, at least it's stained for histopath. And then I start flushing this joint and poop comes out. Like literally poop starts coming out of the joint as I'm lavaging it. And I was like, there is no way this is going to work. So flush everything out. Copious lavage, we'll say. Sew the joint back up, close everything, wrap it up. And I'm thinking there is no way this horse is going to make it.
Fine. Totally fine.
I saw it for vaccines like 6 years later.
Yep.
And I'm like, they just don't make models like this anymore. This is like that old, like some of these horses are like those old Ford trucks that,
Like, I'm built different.
they're like 80 years old, 1 million miles on them. And like, they're like, what? Still
I've
going.
had so many wounds that I've seen, and I'm just like, good God, like this is bad. I would never forget. I say all the time, I wish I could have like a body cam or a GoPro on me, because like the things that people say, I'm just like, man, dang. I get out of my car and get out of the truck and the lady starts talking to me, and I was like, I should have never come here. This is going to be bad. And I walk up to this wound. It's like definitely over 24 hours old, and it's right across the fetlock joint. And I was like, oh no. And she's like, well, I wasn't going to call because back in the day, we would just put her in a cold creek overnight and she'd be fine. And I was like, you would pull a minnow out of this fetlock joint is what you would do. Like, what wasn't in the joint? Well, that I could tell because it was over 24 hours old. Horse was fine. But you know what the client complained about the whole time was bandaging afterwards. I was like, she's like, well, I thought you just stitch it up and leave. I'm like, that's not how this works, ma'am. Mm-hmm. And so setting expectations is hard, but I'm like, that horse is fine.
Mhm.
Well, it kind of leads me to another lesson I learned. Steve Reed, he this is his favorite saying. So we can always euthanize tomorrow. That's his favorite saying. We can always do that tomorrow. And really, what he was saying was like, give him a chance.
Yeah.
And I think that's the one thing. If I could, you read the book, and they'll say, not going to make it.
Yeah.
And you get there, and and everybody knows, like, I'm the one that has no idea we could actually fail. Like, when we fail, I'm like, I didn't see that coming. And everybody else is like, what do you mean you didn't see that coming? And I was like, I don't know. I get there, and it's like, oh, we're going to win. Like, it never crosses my mind to not
We've
not
had
go
to
win.
sit you down before and have a joint discussion and be like, Dan,
I know.
it's time to be
The
done.
writing's on the wall,
Yeah.
Dan.
I know. It
It's
just doesn't
time to
cross
be
my
done.
mind because I'm always like, well, we can always do that tomorrow.
Yeah.
And then what I've seen is it's amazing how many things.
Do better.
Do.
Do get better. Yeah.
Well, and I think people are so appreciative too that you do try. It's like, I mean, I go to some of these ones and you're like, this is a complete dumpster fire. Like, there's absolutely no way that this animal's going to get better. You know, it's like typical down horse you go to,
Yeah.
and you're like, they've been down for like
Long
a
time.
day and a half. You're like, there's no way. But it's just the fact that you try. You
Mhm.
know, you're like, okay, I'm going to try. I'm going to, give it that steroid shot. I'm going to, run some fluids on it. I'm going to, see what I can do. And owners are so appreciative of that.
Well, I
Just
think
because you care. You're showing that you're like, you
Yeah.
know what? I do care. Even if you know in the back of your head that little voice is screaming, you're like, nope, you got to push that pink juice. It's like, nope, let's just give this horse a little bit of grace
Mhm.
and try.
and it's funny because I think trying begets trying. Because you try, you're like, the book says this one's not going to make it. And then it does. And so then the next time you see it, you're like, whoa,
Okay,
we're
let's
going
do
for it.
Mm-hmm. Because
And-
you never know.
Yeah.
You don't.
You never know.
And some of my favorite ones, I can remember calling another one of my mentors, Brian Waldridge. I'd call him. I was like, all right, Brian, I got this case. And I'm going through everything. And when all of a sudden it's just quiet on the end of the phone, he goes, you've reached the end of your diagnostic ability. You have, like, it's like you reached the end of the internet. You reached the end of tests to figure out what's wrong with this horse. And he goes, well, big outcome is sometimes they get better and you have no idea what they had or why. And sure enough, they walk out of here and, like, literally, because you're literally with a stack of papers going,
I don't know.
I've tested for
Mhm.
everything. And then you're looking at your horse and they're just getting better and you're going, I don't know what you had. But it's amazing, like, remembering you can always euthanize tomorrow. Give them a chance.
Mhm.
Yeah.
That was
I-
the most recent one I had was our technician Shelby's horse when it came in here.
Oh,
And its
Susan.
blood work was like off the charts. I'm like, I've never seen blood work in that combination before. This thing was so
Sick.
painful and sick and like out of nowhere. And we were, and we had a conversation on the phone. We were talking at like 11 o'clock at night, and I'm like, Shelby, I don't know what's wrong with this horse. I don't know what to do. I'm like, I'm just gonna throw everything I got at him, and something stuck. I don't know what it was. Never figured it out.
He's fine.
He's fine. He's living his best life. He's got a kid now and
Yeah.
living his dream. And I'm like, oh my God. Like, I never figured it out, but it's driving me crazy. Like, to this day, I'm like, what did you have?
Yeah.
What did you have? There's no reason that you should have looked the way that you did and then gotten better.
I think back to a lot of the old timers, one of their favorite sayings, like, these are the guys that, like, they're like the 25, 30-year veterans. And it's funny because they all say the same thing. Some of them get better in spite of us.
Mm-hmm.
And you know what?
It's
As
the dang truth, man.
I'm kind of approaching that 20-year mark, and I can tell you some of them get better in spite of us. Because you look back and you're like, that should not have worked. And then you realize, like, oh, it actually didn't work. They just got
They got better.
better.
Mm-hmm. They chose life.
Yeah, it's
They choose life.
I think kind of going back to the trying, like people just appreciate you trying thing. I have two big cases for me that I think about, and one is my barn fire horse like that.
Mhm.
I came in, I got a call on my day off, and I could have said no, and I was like, no, I mean, I'll go see what I can do. Like, I don't know. I've never done this before. And, I got there and I triaged her and I did what I could for her in the first couple days. And then she came into the hospital and I was like, this is bad. was like, this is really, really bad. But they wanted me to try. So I said, okay, we'll try. We'll do everything we can. And, those first 2-3 weeks were rough. Like I went home and cried a lot because I was like, I feel like I'm not helping. Like I'm just ripping skin off of this horse and I feel terrible. But then back to your point, I looked at my patient and she was happy.
Happy.
I debrided skin. I got seromas out of there. I got her more comfortable and she was eating. She laid down to sleep. She did her thing. And I was like, man, okay. And then, I'm going to cry today, dang it. But I had the whole team behind me too. And everybody was working really, really hard. And,
Well, it was cool. I mean, we had a lady that, because you can't just look this stuff up in a book,
no.
right? Like you go grab the emergency book, internal meds book, and you're just like, oh, fire. Yep, it's not in there.
No.
Yeah, there was like one paragraph on there.
There's one lecture slide in school about burns. That's it.
And
That's all I had.
And this is what I love about the veterinary community. You found a paper.
Mm-hmm.
You make a phone call to a veterinarian in Australia,
Mm-hmm.
and they answer the phone and like, yeah, I'm in. What can I do to help?
Yeah, and just bounce ideas off and see what works. We tried so many things. And then I called on other mentors and I was like, I have this, what should I do? I went to our annual conference and I went from table to table to table and I was like, what do you have? Like, what can I try? And, the case didn't end the way that I hoped it would. The horse is still alive, but, she, on the people side of things, it got really difficult and really frustrating. And, I still am kind of in the throes of dealing with that emotional side of it. But when I step back and look at the clinical side of it and the patient care side of it, like we did such a good job with her. Like it
was a true team event.
It was. And we tried.
And when I say team, not just the team here, like it was more than just the veterinarians that worked on that case. It was all the staff members that were here.
We spent
Christmas.
hours.
You're in here 4 hours on Christmas.
Ricardo and I on Christmas Day, we were here for 3 hours.
She bit
pulling
the crap
off.
out of Ricardo, and you kept going. Like it was a whole. It does. It takes a village, and it.
But it was the whole veterinary community, from a veterinarian that didn't know you from Adam's house cat in Australia. That's like, yeah, I'll take your phone call and I'll tell you everything I know. Call me if you need something else.
Yeah.
We had strangers that came in like for, just regular appointments and they saw her and they made donations to her bill.
Yeah.
Like people that had no idea who this horse was or who her people were.
Yeah.
Or they donated supplies or, shared her
companies
story.
that stepped in and were like,
companies that stepped in.
we want to test our product. Can you try it? We'll give it to you. And then they're like genuinely like
invested.
Yes.
Yeah.
I mean, not throwing a plug out, but Fovea was like, here.
Yeah.
Here, try
this.
do.
Fovea and Hilltop Bio donated thousands of dollars in products and tried to help her, and it did. I mean, it helped her. But that was a huge case for me, and I learned a lot about people, and I learned a lot about medicine and perseverance, and that was a huge one for me. I mean, that was 8 months of my life that were dedicated to that horse, and it's kind of crazy.
But it all stopped with that. It all started with that attitude of, okay, you know what we're gonna do. We're gonna survive today.
Yeah.
We're gonna survive today. And this horse, we're like it. It really kind of summarizes everything. If you're not sure, make a phone call.
Yeah.
Track down the guy or the person that might be the expert. 2, you know what we're gonna do? We're gonna work through today.
Yeah.
We're gonna work through today. And then 3, like, not being, the book says you're not going to make it. And we're like, no, we're going to try. Because I remember when it first happened, we started looking at the book and they're saying, if you lose X percentage, they're not going to make it. And we're over there going like,
Yeah.
She lost 30% of her skin, and I never put that horse on fluids a single day.
And the book says that can't work.
And she never lost weight. She never stopped eating.
She got fat.
She got fat
I
in
know
that
she
stall.
did.
She did get very fat in there.
Fat.
We ended up having to grow more skin because
we increased our surface area on accident. Like that was a crazy case for me.
But it's those cases, and I can remember working on some really bad laminitis cases, and I mean they were bad.
Yeah.
And you're over there thinking like, what are we doing? And I would even have the techs ask me like, why are you even doing this? And I'm like, because I may save the one. And I said, and the other thing is, this is how we learn.
Yeah.
I've spent a large part of my career dealing with laminitis. And I can remember, if you go all the way back to when I was shoeing, we had 1 or 2 treatments. If those didn't work, we were done. I look at it now, and it's still a horrible, devastating disease,
Mm-hmm.
but it's nowhere near what it used to be.
Mhm.
And yeah, like 10 bad ones walk in, we may only fix one,
Yeah.
but then we learn from those,
Mhm.
and we fix 2.
Yeah.
And then we're fixing 3, and then 4.
Mm-hmm.
And that's how it progresses. So yeah, you walk through some really bad cases. You walk through those struggles,
Mm-hmm.
and you wonder why. And then when you look back and you go, wait a minute, we
That's
have come a long way.
Right.
Mhm.
Because if I'm like, again, goes back to like, listen to what your patient's telling you. And I'm like, you know, my biggest thing has always been like quality of life. I'm like, I don't want my animal to suffer. And
Right.
if I think at any point that I'm like, nope, this animal's too painful to go on, we're not eating, like they don't want to interact, they don't want to stand up, I'm like, that's when we call it. But I'm like, as long as they're giving me a little bit of signs of life, I'm like, we keep going.
Yeah.
Mhm.
I've had a lot of owners that are like, well, I don't know. I'm like, you know, goes back to my like rule of 3 out of 5. I'm like,
Mhm.
they're still doing their 3 out of 5. We can keep going. We
Mhm.
can keep trying, because it's like they're telling me that they want to live,
Mhm.
and I'm going to give them that chance.
Mhm.
Yeah.
And just support them through it.
Yeah.
And you know, I think the other thing I often think about, and I learned this lesson, owners, when they tell you something's not right,
You gotta listen.
You have to listen,
pay attention.
Yeah.
because they know.
Because they're like, I don't know what it is, but something's not right. And you're looking at them like, I mean, they're fine. And they're like, no, I'm telling you, I know this horse. I've had it for 5 years. Something's not right.
Mhm.
And then lo and behold, like when you really listen to them, you're like, okay, well, yeah, first swipe through this horse on an exam, yeah, I'm not finding anything. And they're like, I'm telling you, something's wrong. And you're like, okay, let me dig for a little bit. You may have to leave them with me. Let me dig. Lo and behold, you dig, boom, there it is.
Yeah.
And if you hadn't listened to that owner telling you, like, there's something wrong.
Mhm.
And like, and I've told every veterinarian that's ever walked through here, like, owner says there's something wrong, keep looking.
Mm-hmm.
You're missing something.
Yeah.
Because I mean, you see it in people all the time. You see it in horses. Like, they know something ain't right.
Mhm.
That's probably that whole left brain versus right brain. I always get confused which side of the brain's
I
which,
don't know.
but
Right. But I mean, it goes back to, I mean, we only see them maybe a handful of times a year,
Mhm.
if that. Like, so we don't know. But I'm like, you as an owner, you spend every day with this animal.
Mm-hmm.
You see them on their good days, you see them on their bad days. So you know what this animal's like. And when they're not acting right, you're like, even if I've had people be like, she's too nice. She's being too nice. Normally she's a witch of a mare and she's being too nice. Something's wrong. And lo and behold, she has 105 fever.
Yeah.
Like, and I'm like,
You're not wrong.
you're not wrong.
I mean, that's it, paying attention,
Yeah.
you know, and
Mhm.
listening.
Yeah.
And oh Lord, that's the other thing. If I had to, I always joke, if I ever had to have a career change, I think I'd probably go into law enforcement as a detective, because I have learned how to interrogate, because it never
And
fails.
read between the lines.
You're over there like pulling your hair out. You're trying to figure this out. Like, something's not making sense. Something's not making sense. And then it's always like right at the end, it goes like, I didn't tell you this. I really didn't think it mattered. And then you just kind of freeze because you know what everybody's about to say. That's going to be the puzzle piece you're
Ball
missing.
drop. Yeah.
And they're like, but this is what's going on. And you're like,
Bing, bing, bing,
Mhm.
bing, bing.
now it makes sense.
Yeah.
But
Well, actually, I put them on a kelp supplement like 2 weeks ago.
that-
You did what?
Yeah.
Please don't do that.
Working up an arrhythmia. And turns out kelp.
You put them on kelp.
Yep.
Well, this is an anti-kelp podcast, by the way. So,
Get your thyroid all out of whack.
And then you have AFib.
Yep.
yep.
But no, it's hilarious. Like the things, but if you look at it, how many horses are on kelp don't have an issue?
Uh-huh.
And then you're like,
But the one that
The one.
does.
Yep.
but it's
You
always
found
that
it.
thing that, and so I always joke, like the one thing I've tried to learn to be better about is active listening,
Hmm.
asking questions, hearing what they're saying, understanding what they're saying. Because I swear, like it's always interesting when you're talking to an owner. Like I tell them, like, don't try to talk to me like a veterinarian. Describe it in your own words. Because what I've seen is like the descriptions all of a sudden start making sense. Like, I don't know, kind of all over the place. Well, that's owner speak for like he neurologic.
Mm-hmm. He don't know where his legs are.
He don't know where his legs are. But it's like you learn to hear those things, but you learn how to ask those questions, and you learn how to actively listen.
Mm-hmm.
And I think that was, I think learning how to ask questions and learning how to listen is every bit as important as our physical exam.
Mm-hmm.
But it took me 15 years to figure out, because I'm a guy, right? We don't really hear anything, and my wife says I have selective hearing. I don't know what she's talking about. I wasn't listening, but learning how to listen to what owners are saying.
I think I really underestimated, the percentage of my brain and my energy that was going to go towards being somebody's emotional support person, or, being their kind of like therapist, or they're working through stuff with them. And like, it's so easy to get hung up on the negative interactions you have with people and the negative things that people say out of grief or anger or whatever it is. Like, it's very easy to just carry those things with you and get really calloused. And I always think about, I had a case where it was a weird situation, but the horse got a really bad Clostridial myositis. And I told him, I was like, the percentages aren't good. I said, we can refer. And they were like, no, I'd rather you try. And I was like, okay. So we tried, and she was doing phenomenally. And I had just updated the owner and said, she's back in her stall. She's eating dinner. Everything's good. And she suddenly passed away not even 10 minutes later, like just out of nowhere. And, I had to call her, and it's to this day one of the worst phone calls I've ever had to make. And I just remember being like, dang. I was like, please just be mad at me. Like, be mad at me. Yell at me. Yeah. Tell me I did a bad job. Like, that I can handle. Like, just yell at me. And all she did was say thank you.
Yeah.
Mm-hmm. And it's like, to this day, I'm like, I hold on to that because they are still some of my best clients. And it's like, you got to remember those people because they make it. That's why we do what we do. We're just trying to help.
Mm-hmm. Again, I think the most appreciative people I've ever had are the ones that I didn't save.
Yeah.
That are like, thank you so much for doing everything. And I'm like, but I don't think I did everything.
But you tried.
But I tried. And I showed up and I tried. And I was there for them.
Yeah.
Like, I helped them make a decision that they didn't necessarily want to have to make. And I helped them talk through it and realize it's like, no, it's okay that we're putting this horse down.
Yeah.
No, it's okay that we're, going into hospice. Like, that's okay.
It's that personal connection.
Mm-hmm.
It is. Like, it really is. And it's like, it's where that empathy comes in. It's like, you can't learn that. You either have it or you don't. And it's like, sometimes you have to just, take your vet hat off and you just need to be somebody's friend.
Uh-huh.
Well, and it's hard. I remember talking to a vet student, and they were almost training them not to have that. Like, I remember they actually tell them, don't say I'm sorry.
Oh.
I'm like, I say that like 8 times a day.
I cry with people all the time.
Mm-hmm.
I don't cry.
Well,
but I'm right there with them. Like, I feel it.
Mm-hmm.
And like to hear that that's not part of it. And I think that's the part of the job that I didn't see coming.
We ride the highs and lows with people.
Oh, Lord,
like, we're
yes.
right there with you. Like, that's anybody who says that we don't care, or we don't take stuff home with us, or we don't feel it, like, that's a lie.
Yeah.
Well, I think that's that's the one thing I say about equine medicine, and we've talked about this before, is like, you're there for the goods and the bads. Mm-hmm. And then all of a sudden there's this relationship built with people.
Yeah. Yeah.
You're at their kids' weddings.
Mm-hmm.
Mm-hmm.
Like, they're letting you know they just had a grandchild, or they just had a child themselves.
Mm-hmm.
You celebrate their wins.
Mm-hmm.
My favorite days are Sundays, and because I'm always getting texts of the weekend because a lot of my people work on the weekends are showing. And my favorite one of those Sunday afternoon texts where I get the picture of the kid on the horse, and you can't figure out which horse it is because it's just covered up in ribbons,
You're like, job done.
Mm-hmm.
And I'm hoping they're good because I don't see color that well, so I'm not sure what color we got.
They could be green, they could be yellow.
Yeah.
But
it doesn't matter because it's like 6 months ago that horse was like crippled lame. So
and it's funny because I talk to farriers too, like these big tough guys that are out there shoeing horses, like others here to put shoes on and get paid. Man, I got these guys like calling me on things like, hey, did you hear about so and so? Like, what do you mean? Did you hear about the trip he made? I was like, no, how did you? He's like, I got a buddy that was there. And so this other farrier, like, this horse has a great trip. He's like, oh, Dennis shoots that horse. And he's shooting Dennis the score. And it's like, God, I love it.
That's cool.
I love it. It's amazing.
It's like, you know, it's not the part of the job they tell you about, but it's like, that's what you do it for.
It ends up being the biggest part of the job, I feel like.
Sometimes it's like, you know what, like, this is my win, is like getting to tell that kid that they get to, you know, show their horse again. Or, you know, like, oh no, we made it out of here. Like, you're riding out of this hospital on the trailer alive.
Or getting on the trailer going home and you're just like,
we did it.
Ancient horse and kidney failure, and you're like, oh, there ain't no way. And then they start eating and the blood work gets better and you're like, okay, all right, go live another day, dude.
Yep.
And it's like all the people that got us here and all the things that made it happen and the amazing teams. And I mean, it's just, I love that, man.
Ain't nothing like it.
Love it.
It's something. It's something.
The good days and the bad. It's something.
It's not. I don't think it's a real job sometimes. I'm like, I can't believe that, like, I'd like wake up every day and I get to do this. And I'm like, what, like, when people ask me what I do at work all day, I'm like, I don't know, man.
I don't know, man.
It's like a choose your own adventure every day. I'm like,
no 2 days are the same.
Nope.
I mean, some of them are frustrating, but then I go home at night and all I can think about is there's some guy going into a cubicle in a coat and tie and punching buttons on a computer. And I'm over here like, I just don't want a real job, you know?
One of my favorite things this is sidetracking, but one of the favorite things that, like, Thor thinks that I've ever told him was, like, I'm standing in somebody's yard and they're trying to catch their horse. And there's like 2 other horses, cows, goats, like either an emu or an ostrich. I don't know which one, but they're all stampeding. And I'm standing there just waiting for this guy to catch their horse. And I'm just like watching it all go by. And I'm like, this is my life. This is literally my life right now. Like, I am getting paid to do this.
8 years of higher education and I get to be entertained at work.
Yep.
The saying I've been saying lately is this is a blue collar job with a white collar education.
Yes.
That's a good way to put it.
Because it is, man. I come home and I am dirty and I'm sweaty and I'm hot and whatever. And I'm like, you know, I went through a lot of school to do this, to just be sweaty and covered in horsehair all day.
Yep.
You're like, wow, you're a vet. That's so exciting. I'm like, it's
something.
I was like, you would not believe what I did today.
Just choose what day you ask me.
You have no idea where my arm was.
Well, I'll tell you what, as we're kind of wrapping this up, you know, I want to give a big shout out to all those that came before us and helped us all get where we're at and
pave the path.
Thank y'all for being here. You know, it's this place wouldn't be the same without you. And I think about all the team, you know, think about our whole team here, and I think about all the great people in this world in the horse industry, and you know, all the listeners on this podcast. If you're an OG and been here since episode 1, give us, like, let us know. We want to know who the OGs are. Like, if you've heard all 99, I want to know. So we appreciate y'all being out there. We appreciate y'all listening. April, thanks for recording 99 or 100 of these now. And Casey, thank you for editing 100 episodes now. So we're still in the same studio.
Yep.
We did upgrade our camera system, but
I think if we build a studio and put comfy chairs in it, I might actually fall asleep. So
I know
it's not gonna feel right.
It's not.
It's gonna feel different.
I don't feel like it'd be real if we're in a studio. This isn't a real podcast. Like, if you've ever been to our hospital, you're gonna recognize the studio. It's our treatment room,
it's like,
or one of them. So
you don't hear the tractor like just going down there, or, you know.
Yeah, we're in the treatment room. There's probably a horse in the treatment room next to us. So.
There is. Yep. Waiting for your gastroscope.
Yep. So, well, thanks everybody for listening. Thanks for y'all making this podcast possible. Thanks to all our customers, because none of us really want a real job. So we appreciate y'all. Y'all take care from all of us here at Countryside Equine Hospital. Y'all have a great week and go 100 episodes. Thanks.
Bye.